Hi, this is Dr. Highsmith. Congratulations on your decision to improve your smile. This is what we love to do. So here's some do's and don'ts as far as the temporaries, because you have the temporaries in there right now. Now, as far as what to expect, the teeth can be a little sore for a bit. That's not unusual. Depending on what we did with the gum, sometimes we do some lasering to make sure the gum line is even. Those areas can be a little bit sore for a bit. So hard brushing for a couple of days, you kind of get a pass on that. You basically let your comfort be your guide on that. We have that antibacterial mouth rinse. I do want you to use that twice a day until we're completely finished. It helps kill the bacteria, keep the gums healthy there. Now, as far as the do's and don'ts, the most important thing is to keep in mind these temporaries, although they look nice, they're just for looks. They are not for chewing. They're not for biting. They're temporary. They're just plastic. They can come off. And if that happens on a Saturday night, it's not a lot of fun. So it's just basically biting on the back teeth. If you have something you want to bite a corner of a sandwich, come back in here as much as possible. But right now, it's best not to eat that kind of stuff anyway. So soft stuff, scrambled eggs, mashed potatoes, and things like that. Because if you bite on your front teeth, they can come off because they're not bonded on like the final porcelain will be. When the final porcelain is in there, you can eat normal food, and that's not a problem. As far as apples and corn on the cob, can you eat that with veneers? And the answer is absolutely. So, but not right now, not because the temporaries are on there. Now, it's all one piece, so you can't floss. So, using a water pick is fine. Brushing aggressively is fine. Now, sometimes people get kind of freaked out. Oh my gosh, I don't want to brush real hard. I'll knock them off with a toothbrush. You won't knock them off with a toothbrush, I promise. But do keep the tissue healthy there, because the difference between a good day and a bad day when we bond in the porcelain is the health of the gums. If the gums are irritated and bleeding, it's very difficult to get the adhesive to stick to the tooth because it's not going to stick to blood. So we want to keep the gums very, very healthy. Now, water picks are great if you want to use that, but basically brushing aggressively, using that mouth rinse twice a day is super, super important. I would also avoid heavily pigmented foods like pomegranate juice or something that if you got it on your clothes, you would freak out. So because the plastic can stain a little bit. We found that saffron turns into this nice little yellow, which you'd want to stay away from that for right now. Fairly bland covered foods, coffee and tea, don't worry about it, everybody does that, so that's kind of normal. And also when we see you for the post-op visit after a couple of days or a week, that's when we want to get feedback from you. How do you like the way they look? How's the color? Is it too light, too dark, just right? Do you want to go lighter? You want to go darker? Is it too much? Do you like the size of them? Do you like the shape of them? Do you like the roundness or the squareness? All that is up in the air, because this is a temporary. If there's something about this that you want to change, now's the time to let us know while they're in the temporary, because we can make those adjustments, and then we do a scan and photographs of that and send the information to the lab so that when the porcelain goes in, there are no surprises. It's just a more refined version of what the temporaries look like. So this is how we figure out that, make sure you get what you want, not necessarily what I want. That's pretty much it. Just chew gently, brush aggressively, smile a lot, and take a look at the mirror and make sure that you like the way they look. If there's anything that you want to change from the final ones, now's the time to let us know. Anyway, thank you so much, and we'll see you next time. Bye-bye.